About 50 nurses from the 3 Aspirus hospitals in Upper Michigan are learning about improving the care of elderly patients in a 2-day seminar put on by Aspirus Wausau. TV6's Houghton Hancock Bureau reporter Sarah Blakely attended the seminar for the story.
Somebody that might have a hip fracture.
More than 50% of patients in hospitals are aged 65 years and older. In the 3 UP Aspirus hospitals, that number rises to nearly 65%. Grace Tuzna of Aspirus says for this reason, it's vital to talk with nurses about geriatric care.
When they come into the hospital, they don't come in with just one problem. Usually it's multiple problems. So if somebody comes in and has to have surgery, it's not just the surgery itself, but they come in with other complications. And so it's treating the whole person versus just one diagnosis.
Marcia Fulbrecht of Aurora Healthcare is teaching on an evidence-based practice called ACE, or Acute Care for Elders, that is meant to prevent a functional decline in patients.
It's an approach to recognize what those vulnerabilities are, to keep the person mobile so that we make sure if they came in and they were a functional older adult living at home that they can go back home if at all possible.
Nurses are also learning to communicate with families better on how to care for their parents and grandparents.
We need to keep the families involved in the care of their elderly family members and how we can relate to them and communicate to them what's important in that care.
Fulbrecht says with life expectancy on the rise, hospitals need to be more in tune to the needs of the elderly and know how to have difficult conversations about the status of a patient's health.
So the overarching goal is to train the workforce, to give them the tools they need to provide those good assessments, wonderful interventions, and that we have good care plans for older adults so they stay functional.
Sarah Blakely, TV6 News, White Pine.